So in this section, we're going to talk about total knee arthroplasty and the rehab in phase 1 and 2. So what to expect for the first 6 weeks after a total knee replacement. So after having a total knee, you'll notice that your knee is bandaged up and it can be fairly swollen, sore, and stiff. Most patients will tell us that it feels like there's an elastic band wrapped around their knee for the first couple of months after surgery. That is all very, very normal. Now, just like we talked about in the hip video, slow and steady wins the race. The focus for the first few weeks should be ice, compression, curtailing your activities, and not trying to bend your knee all the way in the first few weeks, okay? Rome was not built in a day. You have to remember that as the swelling and soft tissue inflammation settles down, that your knee will bend more and more over time. And your experienced physical therapist will help you with this. It's not realistic to think that you're going to come out of a knee replacement and suddenly within a few weeks be able to bend your knee to 125 or 130 degrees. It's just not going to happen. Remember that we open your knee up from the front. So those stitches, the big stitches we put under the skin at the front of your knee, are holding everything together. So if you inadvertently fell on your knee or forced your knee into flexion, you could literally tear out those stitches. So that's an important point that I want to come back to. We do nerve blocks and long-acting local anesthetic in your knee to make this as a pleasant experience as possible. The long-acting local, the Exparel, keeps your knee partially frozen for 2 to 3 days, and we see it routinely with patients. You need to keep that in mind because in the first 3 days, it's like if I froze your hand with some Novocaine and told you to put it on a hot stove, you would not know that you're burning your hand. You would not have the pain fibers to give you the feedback to say, wait a second, I'm burning my hand here. The same is true in the first 3 days after knee replacement. That long-acting local anesthetic is in your knee, and if you or a therapist or someone tries to push your knee too far, you may be doing damage and not even realize it. So, as a rule of thumb, the first 3 days, we just want you walking and dangling your knee, focus on the ice and compression. When the blocks wear off after 3 or 4 days, you can go to your therapist and start working on the total knee rehab protocol. Continue with the ice and compression, and slow and steady will win the race. You're doing yourself a disservice if you push yourself too hard too fast, because all that you will do is stir up a bunch of inflammation and bleeding and make the progress of the range of motion worse. So I hope this helps. The therapist will definitely help you. Having a good therapist and being hyper vigilant about doing your exercises and working on your range of motion will go a long way to give you a knee replacement that should function well and last you for many decades. Thanks.